Hello, hello. How is everybody? My name is Maria de Almeida. I am psychoanalyst, so if you have any questions about therapy or videos, send me a message. You have all my contact details online. Today, I wanted to talk about a very unfortunately common disorder which makes the lives of the patient and their families quite difficult. Food disorders. One of the things that appears from the very beginning in the baby is the relationship between nutrition and the wish of being loved. The first stage in the development of the libido is the oral phase. In this phase, babies or kids put in their mouth, they eat everything they love. But what happens when they do that? It happens that they destroy it. This is why the oral phase is also called the sadistic phase, because there is love, but there is also hate. This is very visible in small kids. For example, they like a cookie, they put it in their mouth because they love it, but then they cry because they realize that they have destroyed it. At a later stage, this wish of being fed is going to be substituted by the wish of being loved. Normally this wish is repressed. So imagine, things are becoming quite complex because nutrition, which is a super important physiological need to the point that if we don't eat, we die, can be disrupted by our unconscious wishes, most of the time repressed. And this happens because we are human beings, so everything has to be learned and built. There is not such an instinct of the nutrition. Because of that, nutrition, there can appear a lot of disorders affecting nutrition. Let's talk about anorexia today. Anorexia is not a disease, it's a symptom that is going to show that there is a disease. In fact, anorexia is the paradigm between need and desire. As I have said before, nutrition goes beyond the need. We are not animals, so nutrition is a lot more complex. We are going to see that in nutrition, there are a lot of things involved, from the pleasure in the mouth to the repressed desire of being loved. It gets a lot more complicated. In anorexia, what happens is that the patient is going to stop eating, or they are going to reduce a lot the intake of food, and they can put their life at risk. However, the problem in anorexia is not with the food. The problem is that the patient is taking a psychic position in which the relationship, the intake of food, is going to be hugely affected. As we know well in psychoanalysis, the symptom is not what happened to the patient. In order to understand what is going on, we need to listen to the patient. The patient needs to talk and say, and we need to understand what is the relationship between the patient and the symptom, and which sentence is the patient using to describe that symptom, to talk about that symptom. There are at least three clinical positions, structures, that could be behind anorexia. First, it could be a hysteria. How do we know if it's hysteria? Well, we need to listen to the patient and to the sentence the patient is using. In the case of hysteria, the patient would be saying a sentence along the lines of, "Oh no, I don't eat because I feel gross, food makes me vomit, I feel nausea." It is super common, vomiting and nausea in hysterical patients. It's one of the most common symptoms. In the alphabet of hysterical patients, vomiting and nausea is synonym of moral repugnance. Another clinical structure that could be behind anorexia is psychosis, and especially paranoia. In this case, the patient would be saying sentences like, "Oh no, I don't want to eat because I think food is going to harm me." Or, a bit exaggerated, but they could be saying things like, "Oh no, food is going to poison me." So psychosis, that as you can imagine is one of the most complex mental health disorders, is characteristic in this disorder that patients tend to say that there are people chasing them, that they want to harm them, and most of the cases, these people are not indifferent to the patient. They are people they love. And then the third structure that could be behind anorexia is depression. As you know, behind depression, depression is featured by a lack of interest in the outside world, So of course this lack of interest could be extended to the food. In this case, the patient would be saying sentences like, I'm not hungry, I don't like food anymore, I don't feel like eating. What happens in anorexia is that there is a regression to an oral phase. Remember that I have explained you before that oral phase is sadistic phase, which means that the relationships of patients with anorexia tend to be sadistic. They love super passionately to the point that they identify with their love object, but then they vomit. Like the very minimal contradiction or difference with the love object is going to make them vomit. Anorexia is quite complex because, as I have mentioned before, it's not only a need, it's also very related with the joy we experience in the mouth, and the first time that we experience joy in the mouth is when we are babies and we are fed. So that's why it's so important, the first relationship, the first contact of the baby with the food. How is he going to be fed and who is going to do that? That's again, we are not enjoying the food exactly, we are enjoying the mouth and the person who is giving us the food. It happens that in most of the patients who suffer from anorexia, they say in their speech that their mom were rejecting them or that they were not very interested in feeding them. It doesn't mean that all the mothers who reject their babies or who are not paying a lot of attention on feeding them or how they feed them are going to end up having children who suffer from anorexia. What is true is that people who suffer from anorexia have this type of experience in their childhood, and they mention that when they talk about their symptoms. Anorexia is super complex because, as we have seen, nutrition is so important that if we don't eat, we die. Anorexia and all the mental health disorders behind anorexia and many other mental health disorders sometimes are related with mortality. Why? Because for us as human beings, and this needs to happen all or at an unconscious level, it's quite difficult to elaborate the idea of one day we will die. So sometimes when we struggle to elaborate that, when we struggle to elaborate mortality, we get disease. And anorexia would be an example of that. In my next video, I will show you with a clinical example. Thank you very much. Bye!